अभी आ गया बट्टी मारने वाला लिस्ट. Increased SHBG, decreased SHBG. Examiner is going to haunt you with these causes. High estrogens like OCPs, they increase the sex hormone binding globulin. That's the reason OCPs also can help you to treat hyperandrogenism, because typically they increase the sex hormone binding globulin and decrease the free testosterone. Pregnancy, liver cirrhosis, elevated thyroid, they are the causes of increased SHBG. Then what decreases the sex hormone binding globulin? PCOD, adrenal hyperplasia, Cushing's syndrome, growth hormone, insulin, prolactin, increased androgens themselves, they decrease the SHBG and increase the free testosterone levels. So you are promising me that you are not going to forget this. Now, doc, what are the causes of the Hirsutism? Is a favorite MCQ in the exam. It can be certain ovarian reasons. PCOD is most common cause, masculinizing tumor of ovary. Erinoblastoma can lead to hirsutism. Thecal lutein cyst, luteoma of pregnancy. It can be adrenal related, like congenital adrenal hyperplasia, adrenal tumor, Cushing syndrome. It can be other factors like acromegaly, hyperprolactinemia, hypothyroidism. You need to be remember as the causes for the development of hirsutism. Now, another favorite question of the examiner, doctor, once more. By heart mugging, cramming, it is inevitable part of exam, any entrance exam. Even if you go for USMLE, you go for any exam. But you need to have a small list in your pocket. So all these notes become available in the onlinemmbbs.com. So no need of writing a handwritten notes. You will get an opportunity to receive these notes. So, doc, anabolic steroids, danazole, metoclopramide, methyl dopa, phenothiazines, progestins, reserpin, testosterone, they're all the medications. Then, what are the things that lead to hypertrichosis, excessive growth of hair? Cyclosporin, diazoxide, hydrocortisone, minoxidil, penicillamine, phenytoin, sorelins, they all lead to hypertrichosis. Even streptomycin. Now, doctor, how do you treat hirsutism? Suppose the cause of hirsutism is an elevated testosterone which is coming from the ovary because of erinoblastoma, PCOD, whatever be the reason. There you can give a combined OCP which is containing drospirenone or desogestrol or cyproterone acetate. That is a treatment. Suppose if there is a normal testosterone in a hirsutism patient and dihydroepiandrosterone sulfate is elevated, then you need to use anti-androgens as a treatment. Then dexamethasone is another option which is available for you to administer when the patient is having normal testosterone with hirsutism. Now, the next important point that you need to know is galactoria. All of you know what is galactoria? Milky fluid secretion inappropriately not related to childbirth. And this secretion contains fat globules, So any white secretion from the nipple is not milk, so you need to confirm it by checking the fat globules.